Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Steve Yaskin, the CEO at Health Gorilla. Steve, how are you today?
I'm great, excellent. Thanks, Jared, for having me.
I think I'm going to say what everyone is thinking right now, Steve. What an amazing logo. And look at that shirt right now. That is such a cool like mascot logo company. So and the colors as well. I know that's like the weirdest thing to start off a show about, but I'm a fan. I say whatever pops into my mind immediately. Super.
Thank you. It's actually a mountain gorilla, so it's kind of a big, very smart animal, very powerful, but also very friendly animal in the jungle.
I love it. I love it. Let's kick things off, Steve. You tell the audience a little bit about yourself, and then give us an overview of Health Gorilla for those that haven't heard of the company.
Yeah, no, it sounds good. I can't believe I'm saying that, but we're looking at about 8 years of being in existence, so not exactly a startup anymore. But the company was created with a single goal of resetting permitted data access to clinical data for the whole country. I am on a few boards. I advise a lot of young entrepreneurs, especially in healthcare world. And my first advice always has been, don't try and boil the ocean. Just do one thing, do it really well. And we did exact opposite here at Health Gorilla. We set out to boil the ocean exactly, and we always had a vision to do something really on the national scale here from day one. We knew it's going to take quite some time, a lot of effort, but we are right there now.
You've obviously, like you said, you're on the board of a couple companies. You advise companies. You're no stranger to the entrepreneurial nature and building companies. I have to ask, what advice you would give to also young upcoming healthcare entrepreneurs, because this is a different landscape, right, than even a couple years ago. So, um, the advice that maybe you would have given them a couple years ago would be a little bit different now. What would you advise them today, like for those who want to start companies in this climate today?
Sure. Just a couple of words about my background. So I am not from healthcare originally, right? My background, I'm a physicist by training, so I have an advanced degree in physics, theoretical physics. It's all numerical physics, which brought me into the data world. So my previous four companies actually dealt with large big data, massive analysis processing, NLP, ontology, taxonomy, everything that has to do with the data processing. But inadvertently, you look across the landscape where data is most prevalent, and you will quickly realize healthcare is probably 20 years behind all other industries, right? Where we know how to deal with the data, we know how to process data, we know how to effectively use data in the industries like fintech, gaming, social, and others. And one of the reasons healthcare is so much behind is because it's so heavily regulated, right? There's tons and tons of red tape. There's actual HIPAA law. There's many laws, and there's a lot of incumbents. There's a lot of weird dynamics, and there's a lot of mistrust. Payers, doctors don't trust payers. Consumers don't trust virtually anybody on the market. There's huge advent in digital health that we experienced over the last couple of years. Lots of VC money were poured into digital health, and unfortunately, we've seen this market erode dramatically over 22 and 23, and probably will continue that trend into the 24. So there are huge opportunities, nevertheless, right? People that are coming in from fintech, from other industries into healthcare quickly think that how hard can it be, right? It's a database. I'll slap UI on top of that. I go to market, and then they realize that beyond red tape and regulatory things, there's so much legacy mentality and incumbency on the market, and they start spinning wheels and all of that. But again, the same advice. There are a lot of advances like artificial intelligence, responsible AI. There are many things that are finding their way into healthcare right now. President Biden released executive order a few days ago outlining the notion of responsible AI, and there's a lot of applications, right? But in healthcare, a lot of times things start with regulatory orders, with bills and laws, actually. And this is how Health Gorilla started. We took 21st Century Cures Act and we built a product, Silicon Valley style product, out of an act of Congress. And that's how we got our start here. So I recommend in a lot of cases learn very specific field from regulatory and then see if there's an application to build a product on top of that.
And within when you were talking about advice, you mentioned regulatory a couple different times. Can you give us an update on kind of where things stand in the regulatory space right now, and also kind of how does it look from your point of view?
Sure. Yeah, absolutely. There's a long history of how data has been exchanged and what do we call data in healthcare, how we treat it, right? And there's always this philosophical debate that's going on in the country: who owns the data? Consumers think, well, it's my blood, right? So I have to own the chemical analysis of my blood. It's my body. So provider then comes in and says, hey, you can't really interpret that. I went to medical school. I have experience. I am the one legally ordering that blood work for you. So I am the recipient of that data. So I own it and I must guard it and protect it by law. So I'm the owner. And then an insurance, a plan comes in and says, I pay for all of you guys, right? So I buy I own the data by virtue of conducting a financial transaction here as an insurance plan. So, like, we're thinking a little bit different here. Instead of asking who owns the data, we say who has access to that data. Permitted purposes of establishing who are you and why do you need access to that data, and that's what we're enforcing in the market. So, if I don't want to go back 20 years ago, but I want to go back to the act that Obama administration passed called 21st Century Cures Act. This is when Congress said, we're going to switch doctors to electronic medical records away from the paper. Government largely succeeded in doing that, but we also created a monster because we have hundreds and hundreds of vendors that are capturing this data, creating silos, and none of them were designed to interoperate or exchange data between each other. So again, we passed another law, another regulation called TEFCA, Trusted Exchange Framework Common Agreement. And that's the current thing in which my company is involved, and a few other large companies like Epic and a few other interoperability or EHR companies are involved. And that is the new law that is designed to reset the floor, how we interoperate, how we exchange data. And basically, we'll look at permitted purposes, or we call them actors, who can see clinical data and how it's mandated to be exchanged in the whole country. And the permitted purposes, there's a total of 6 of them. One that works today already is treatment, meaning your doctor could exchange your clinical data with another provider that actually actively treating you. That's called treatment. And I'm simplifying things, but the second permitted purpose is called individual access service, kind of a boring name for basic consumer right to see their own data. And then you have payments and operations, which allows your insurance company to actually see minimum required data set. Not everything, but as much as they need to conduct operations and payments. And then there's public health, which is, CDC and many other large public health organizations that will be able to see that for population health assessment, prevention of pandemic, and many, many other reasons, reducing something we call underserved population in this country. So those are the new 6 permitted purposes, greatly expanded from just treatment, and this is what is going on in the country right now, and it's designed to kind of reset the floor how we exchange data for permitted purposes.
Super interesting. Thank you for giving us kind of an update and also your point of view on everything. And it's interesting to see how things have changed over the years, right? And always what new regulations get implemented, and then how do you navigate those. One thing I wanted to also chat about, Steve, with you having you on the podcast is you recently announced a partnership with Health Tap. Can you talk us through kind of how this came to be and really what excites you about it?
We strongly believe that telemedicine has a long way to go yet in this country. There's a lot of debate whether the reimbursement should be increasing or decreasing right after we came out of pandemic. But telemedicine overall, telecare, virtual services are here to stay. American population embraced that concept, and more people utilizing those services. So we are standing behind virtual care, telehealth, and many other aspects. Health App is one of my personal favorite companies because they figured out how to effectively bring it into the consumers, make it really easy to engage with the platform, and just like any other companies that is successful in implementing, automating certain clinical workflows or administering virtual care, they need access to data, and we are very happy to provide permitted access to Health App. And actually, Health App is one of the several organizations that committed to join this new TAFCA program that I was talking about under Health Gorilla, become participant in Health Gorilla network nationally. So very excited about that.
Yeah, I was excited to see the relationship and look forward to seeing how that continues to grow and also what you're continuing to build. In terms of Health Gorilla, what's next that you want to share with the audience here today? What's exciting you about, let's say, the last part of the year heading into 2024 and beyond?
Uh, we are fairly focused on the privacy of clinical data. We have enormous power, but also enormous liabilities. So Health Gorilla is all about governance and privacy, right? We operate as a QHIN. It's called Qualified Health Information Network. We've been working as a HIN, HIN, and now we got this Q in front of our name, which means we are we're candidate to be federally approved by end of the year to go live as a qualified health information network. And this has been a few years in the making. Uh, Policy, technology, and the first thing that we've been working on, the most important thing is governance. TAFCA, as a law as it stands, the first letter in that abbreviation is T, standing for trust. So to do that, to gain trust of federal government and states to exchange data, we had to do a lot of work, and that's what we've been doing for the past couple of years. Looking into the next year, 24, I think permitted access to high quality, high actionable data that actually makes sense for a variety of the organizations within healthcare ecosystem, payers, providers, digital health, operational companies, research companies, and many others that are now will be permitted to gain access to the totality of the data. And it's not just clinical. We are producing social determinants of health. We're producing financial data. There's all kinds of related data which affects your health. This will create so many opportunities going into the 24 that I cannot be less excited about the potential here to reset the floor on data and a lot of innovation, including responsible AI, including machine learning. What do they all need? Clinical workflows. What do they all need? They need access to data. And I think this partnership between federal government and the private sector, which is what TAFCA is designed to be, will start so much innovation, will enable so much innovation in 24 that we are looking into the new era of healthcare.
Well, Steve, I've really enjoyed our conversation here today and hearing more about Health Gorilla and not many people can make the regulation side like to keep everyone too engaged and interested, and you did. So I appreciate your point of view and giving us that update. Definitely want to have you come back on in the near future. And again, really appreciate you joining us here today.